I'm Dr. Cheryl Burgess, board certified dermatologist in downtown Washington, D.C. My practice is Center for Dermatology and Dermatologic Surgery. I'm here today with my nurse,
Carla Ullman.
So we're going to demonstrate today the Exci308, which is the narrow band 308 nanometer wavelength for treatment of vitiligo, psoriasis, and atopic dermatitis or eczema, and how easy and useful this can be in your practice, particularly if you have conditions and where patients need that extra treatment or they're not suitable to have or use prescription therapy. So this device here is handheld. And in my previous residency training, I trained with UVA and UVB, but the patients had to come and stand in a booth. But this here can be used for selective areas such as like segmental vitiligo, eczema, patches, or even little patches or plaques of psoriasis.
It's a quick, easy treatment, in and out.
I have a patient here, Lungi, who developed segmental vitiligo on the right side of his face in the trigeminal nerve area. And this was probably about a year and a half ago. It was around the time when Opzelura, which is a topical cream that was one of the first FDA cleared creams for vitiligo. So we started him on that immediately, and he used it twice a day. And then I got this device here, which is called the Exci308. He had been on the Opzelura for about 6 months, and then starting this in conjunction with a topical cream at home, we saw a lot of improvement and more fast, effective from treatment to treatment. He came in twice a week for this treatment, and we just saw great improvement. So this is a 308 Exci device, which is the wavelength of narrow band UVB at 308 nanometers. So this is something that is possible to use in your office. I trained at a vitiligo center where we had big UVB, UVA booths that people would get in. And so this is a great improvement from years ago when we had to have people come and get in the booth. So this is a treatment that can be directly applied to the area of involvement without exposing the other areas of skin to UVB radiation. This device, Exci308, narrowband UVB, can be used by physicians and the physician staff, such as nurses, in treatment of vitiligo, eczema, psoriasis, and other conditions in where we find narrowband UVB is beneficial.
My name is Lungi Okoko, and I'm 45 years old. About 2 years ago, I started to notice some spots on my face. So lighter spots, and then they got larger and larger. At a certain point, just decided to come and see a dermatologist, started to explore different treatments. Prior to using the Exci machine, we tried different treatment options. Some were steroids, and then there was also a topical treatment, Opzelura. We started to see some changes, some slight improvements, but it was very slow. And then a few months later, it was probably 3 or 4 months later, Dr. Burgess, my dermatologist, started using the Exci machine. And that's where we started to see very drastic improvement. Essentially, the spots were starting to get smaller around my mouth, close to my eyes, and on the side of my face. My skin journey has been interesting, just from discovering the spots, the initial shock of it. I never really thought I would have vitiligo, and what was interesting was, I would tell it doesn't really hurt. I guess the main thing is just the appearance. When you look in the mirror, you're used to seeing your face a certain way since a young age, and so just to see what felt like almost disfiguration was could be challenging. I guess there were times when I was self-conscious, and I sit on a lot of video conference calls, so people look at my face all day pretty much, and so it was encouraging to see the improvements that were made when we started to use the Exci machine.
In my practice, the Exci308 has been very effective, particularly in vitiligo. Because I trained in vitiligo, my office isn't large enough in order to acquire and sustain a narrowband booth that patients would come and get in. And also, you're exposing the entire body to the ultraviolet rays. So this type of device, which I can put it on local areas, and for instance, one of my vitiligo patients is 3 seconds. So it's 3 seconds here, 3 seconds here, 3 seconds in a different location, and I can treat them in a matter of minutes in their condition. So it doesn't have to be just one little spot. It could be multiple spots on the patient. And so that's what I like about this. It's very lightweight. It's not heavy. We have electrical outlets in our exam tables, so we just plug it in right at the exam table and treat the patients. And it's simple as that. As far as vitiligo, generally the treatment for psoriasis and eczema, sometimes they want you to go through a full treatment of different prescription medications, and this is like the last thing, or we have to get a pre-authorization in order to use this. And some of the codes here that we have used is 96910 for reimbursement for narrowband UVB light. I chose the Exci308 narrowband UVB device primarily because of its portability. I have 2 offices, and in fact, that's why I got the other devices. They fit in a little suitcase. I can take them to my Annapolis office and my DC office, and I go back and forth. But in fact, I think I don't have to do my Neo now because I bought another one. That's how much I use this device. I definitely use it on a daily basis, and Aerolase has been very supportive with what I need and my training manuals. You have training manuals on acne and eczema and all the devices that they have that have been worked out and proven to be effective, that everyone who gets the device can be on the same page. So we have the Exci308, we have the Neoderm, and then we also have the Era, which is their whole portfolio in laser devices. And we have been just simply thrilled with the effectiveness and the portability of them, and we can see our patients no matter what location. So this has been really a great investment for the Center for Dermatology and Dermatologic Surgery.